Hello. Today we will be talking about a brief synopsis of our upcoming article, Hepatic Steatosis in the Pediatric Population, an overview of pathophysiology, genetics, and diagnostic workup. My name is Charina Ramirez, and I am an associate professor in the Pediatric Gastroenterology, Hepatology, and Nutrition Division at the UT Southwestern Medical Center and Children's Health in Dallas, Texas. And joining me today is Dr. Claudia Phen.
Hi everyone, I'm Claudia Phen, a third-year pediatric GI fellow here at UT Southwestern, and I'm excited to talk with you all about fatty liver disease. Dr. Ramirez, can we start off with a personal question? Can you tell us about any early influences during your training and how this led to an interest in fatty liver disease?
Sure. So during my fellowship training, which is about a decade ago, I had the good fortune of being able to work in the lab of Dr. John Dietschy and Dr. Stephen Turley. We studied the cholesterol movement within the lysosome of the hepatocytes and other organs using different mouse models. After that, when I became a clinical faculty, I then teamed up with Jennifer Panganiban, and we conducted a pilot study in pediatric patients with metabolic associated liver disease. These experiences helped me then gain more experience and then develop a program in a clinic within our liver center for fatty liver disease.
Interesting. Thank you for sharing that with us. Can you expand a bit on the pathophysiology of fatty liver disease?
Sure. So there are various theories out there, and the most widely accepted one is the multiple hit hypothesis, which takes into account key factors like dietary intake, environmental and genetic factors, as well as changes in the gut microbiome. So in our Western diet, we consume so much carbohydrates and fat, and that acts as substrates that lead to buildup of free fatty acids and triglycerides within our liver. And in patients who have a genetic predisposition, they then have accumulation of lipotoxic lipids, unesterified cholesterol, and ceramides, which lead to hepatocellular damage and inflammation. And this just cycles back and forth. And in about 30 to 40% of these patients, they'll go on to develop fibrosis, and then some will then develop cirrhosis, which will require liver transplantation. Unfortunately, some also develop hepatocellular carcinoma. So it's really important for clinicians to start early on with dietary interventions in the young patients, just so this bad outcome can be avoided.
That's a very detailed and intricate process.
Yeah, so Dr. Phen, part of your research has been to look at the genetics of fatty liver disease and various liver conditions. Do you mind sharing what you've learned so far with us?
Yes, I can. So the big takeaway about genetics is that there are several variants under investigation that can increase or decrease one's risk for developing fatty liver disease. Here at UT Southwestern, Dr. Helen Hobbs and her team discovered a major genetic variant in a gene called PNPLA3, which can increase one's risk of fatty liver disease. In both mice and humans, the effect of this variant was actually amplified in diets rich in carbohydrates. There's also thought to be a protective variant in a different gene, HSD17B13, that may confer protection against the development of chronic liver disease. So clearly, there's an interplay between genetic and environmental factors.
Thank you for sharing that with us. It seemed like you've learned a lot.
I really have. Dr. Ramirez, one final question. You take care of a lot of these patients in your fatty liver clinic here at our center. How do you evaluate for this condition?
So I used the NASPGAN guidelines that take into account recommendation for workup with patients with persistently elevated ALT, so more than 3 months, and 2 times the upper limit of normal. And so because metabolic associated fatty liver disease can coexist or even mimic other causes of hepatic steatosis, workup for underlying causes is important. Now, there are other red flags that people should pay attention to, which includes organomegaly, kidney involvement, global delay, and other system involvement to look for the rarer causes of hepatic steatosis. And this is nicely outlined in a table in our article, so enjoy your reading.
Thanks so much, everyone, for tuning in. We really hope you enjoyed this overview. And like Dr. Ramirez stated, we welcome you to further explore our article and figures online for more details.